Every winter, pharmacies turn into cold and flu battlefields. Runny nose, blocked nose, sore throat, heavy head, dry cough, chesty cough. And in the middle of all this, there's always that one question. Just give me something strong, doctor. One shot. Anything. But here's the problem. Most people have no idea what's inside their cold and flu medicines, which syrup is for which cough, or when these simple sachets and syrups can actually be the wrong choice. So in this video, let's make cold, flu, sore throat and cough medicine simple, clear and a little bit shocking in a good way. I'm Ammar, a licensed pharmacist, and this is Medicine Wise. If you want honest, simple explanations about the medicines you already have in your home, hit subscribe and let's get started. First, let's clear one big confusion. A cold is usually milder runny nose, blocked nose, sore throat, low-grade fever, body ache. Flu can hit harder, higher fever, more body pain. You feel like you've been hit by a truck, sometimes with chest symptoms. But whether it's cold or flu, most pharmacy products don't cure the virus. They just control the symptoms while your body does the real work in the background. Now let's step into the cold and flu aisle. Those colorful sachets and tablets are usually a cocktail in one dose. Most of them combine a pain and fever ingredient, often paracetamol or something similar, a decongestant to open your blocked nose, sometimes an antihistamine to reduce runny nose and sneezing, sometimes a cough suppressant or extra ingredient. They are like all-in-one comfort packs. Sounds convenient, right? But convenience always comes with conditions. First big issue, double paracetamol. People drink a cold and flu sachet that already contains paracetamol. Then they add extra paracetamol tablets for headache. Then maybe a flu and pain capsule on top. 3 different products. One same liver. So your smart rule number 1. Anytime you buy a cold and flu combination, ask yourself, does this already contain a pain and fever medicine? If yes, do not layer more of the same on top unless a doctor specifically tells you. Second big issue, the decongestant. That magical, unblocks your nose ingredient can also raise your blood pressure, increase your heart rate, make you feel a bit wired or anxious in some cases. So if you have high blood pressure, heart disease, thyroid problems, glaucoma, or you're pregnant, you cannot treat cold and flu combinations like candy. For many of these people, saline nasal sprays, steam, simple paracetamol, rest and fluids may be a lot safer than strong combos. Now, what about day and night formulas? Day formulas usually try to keep you sharp and awake. They may have a non-drowsy antihistamine or just decongestant plus pain relief. Night formulas often include an ingredient that makes you sleepy, a sedating antihistamine. That can be helpful at night, but it also means no driving, no operating machines. Be extra careful if you already take sleeping pills, anxiety meds, or alcohol. Nighttime on the box doesn't mean harmless sleeping juice. It still has active drugs. Alright, now let's move to sore throat. Sore throat can come from simple viral infections, irritation, talking a lot, dry air, smoking, reflux, or from bacterial infections that sometimes need antibiotics, but not always. On the sore throat shelf you'll find lozenges with antiseptic, mild local anesthetic, or soothing herbs, sprays that locally numb or disinfect the throat, gargles for antiseptic or soothing action. Most of these give symptom relief, not magic cure. They can make swallowing easier, reduce burning and dryness, and help you drink and eat better, which is already valuable. But if you have very high fever, swollen glands with severe pain, difficulty swallowing, even water drooling, or struggling to breathe, rash plus sore throat, that is not the time to keep sucking lozenges. That is time for a proper medical check. Now let's talk about the star of winter, cough. People always say, "Give me the best cough syrup." But there is no best syrup if we don't know what kind of cough we are treating. Think of cough in two simple categories. Number 1, dry cough. Tickly, irritating, nothing much comes out. It can keep you awake at night, often after a viral infection or irritant. Number 2, chesty or wet cough. You feel mucus or phlegm inside. You're trying to bring it up and out. Sometimes noisy and heavy. Now, cough medicines usually go in two directions. For dry cough, we use cough suppressants. They calm down the cough reflex. Useful at night when the cough is not helping, just annoying. For chesty cough, we use expectorants or mucolytics. They thin the mucus and make it easier to cough it out. If you mix them incorrectly, you can get into trouble. If you take a strong cough suppressant while your lungs are full of mucus, you're basically asking your lungs to stay silent while they are trying to clean themselves. Not smart. So whenever you pick a syrup, ask yourself out loud, is my cough mostly dry and irritating, or is my cough mostly wet and chesty? And remember, for many people, simple things like honey in warm water, steam, hydration, and avoiding smoke are just as important as the syrup. Let's add a layer that almost nobody discusses: cough plus red flags. You should not rely on over-the-counter cough syrups alone. If you're coughing blood, you have chest pain, tightness, or shortness of breath, you have a high fever that doesn't improve, your cough lasts more than 2 to 3 weeks, you've lost weight unintentionally, you have night sweats, or feel very weak. In those cases, cough is not the problem, it is a warning sign of something deeper. One more important point: antibiotics. Many people still think, it's been 3 days of cold and cough, I need an antibiotic. But most simple colds and flus are caused by viruses, and antibiotics do nothing to viruses. They only add side effects and increase resistance. Your doctor may give antibiotics if they suspect a secondary bacterial infection, but they should not be your automatic wish after a few days of runny nose and sore throat. So, how can you use cold, flu, sore throat, and cough medicines wisely? Here is your quick smart patient checklist. For cold and flu combinations, check if they already contain a pain and fever ingredient like paracetamol. Avoid doubling that with extra tablets unless your doctor told you. Be cautious if you have high blood pressure, heart disease, thyroid issues, or you're pregnant. For sore throat, lozenges, sprays and gargles are for comfort, not magic cure. If swallowing or breathing is difficult, or you feel very unwell, see a doctor. For cough, first decide, is it mostly dry or mostly wet? Use suppressants for dry and mucus-thinning syrups for chesty, not the other way around. Watch for red flags like blood, long duration, weight loss, or severe chest symptoms. And above all, remember that cold and flu medicines are there to support your body, not to silence it at any cost. If this helped you understand your cold and cough medicines more clearly, subscribe to Medicine Wise by Ammar for more simple, honest videos about the medicines you use every day. For more clear medicine and nutrition tips, subscribe to Medicine Wise by Ammar. This is general education only. Always consult your own doctor or dietitian before changing your diet or medicines.